Cancer. Even the word itself can evoke fear and uncertainty. Conventional treatments like chemotherapy, radiation, and surgery are often the first line of defense, and for good reason. These treatments have saved countless lives and continue to be cornerstones of cancer care. However, these traditional approaches can come with a host of debilitating side effects, impacting patients' quality of life. Nausea, fatigue, hair loss, and weakened immune systems are just a few of the challenges individuals may face. Moreover, conventional treatments may not always be effective for all types of cancer or at all stages of the disease. It is in these situations where conventional treatments fall short that many patients and their loved ones begin to explore alternative therapies. The world of alternative cancer therapies is vast and varied, offering patients a diverse array of options to explore. These therapies, often drawing upon centuries-old healing practices, provide a holistic approach to cancer care. One such therapy that has gained considerable attention in recent years is herbal medicine. Derived from plants and botanicals, herbal remedies have been used for medicinal purposes for centuries across various cultures. Certain herbs like turmeric and ginger possess potent anti-inflammatory properties, which can help mitigate some of the side effects associated with conventional cancer treatments. Acupuncture, an ancient Chinese practice, is another alternative therapy that has shown promise in alleviating cancer-related symptoms. Mind-body techniques such as meditation, yoga, and Tai Chi focus on the interconnectedness of the mind and body, recognizing the powerful influence our thoughts and emotions can have on our physical health. Herbal medicine, often referred to as botanical medicine or phytomedicine, represents one of the oldest and most enduring forms of healthcare known to humankind. One such herb that has garnered significant attention for its anti-cancer properties is turmeric. This vibrant yellow spice, a staple in Indian cuisine, contains a powerful compound called curcumin, which exhibits potent anti-inflammatory and antioxidant effects. Studies have shown that curcumin can inhibit the growth of cancer cells and make them more susceptible to chemotherapy and radiation. Another herb with a long history of medicinal use is ginger, known for its ability to soothe nausea and aid digestion. Milk thistle, a flowering herb native to the Mediterranean region, has been traditionally used to support liver health, mitigating some of the side effects associated with chemotherapy. Acupuncture, an integral part of traditional Chinese medicine for over 2,500 years, is based on the concept of qi, or vital energy, flowing through pathways in the body known as meridians. Acupuncturists aim to restore this balance by inserting thin, sterile needles into specific acupoints along these meridians, stimulating the body's natural healing abilities. While acupuncture is not a cure for cancer, studies suggest it can effectively manage various cancer-related symptoms and side effects of conventional treatments. One of the most well-documented benefits of acupuncture for cancer patients is its ability to relieve nausea and vomiting induced by chemotherapy. Pain management is another area where acupuncture has shown promise for cancer patients. Studies have demonstrated that acupuncture can be as effective as conventional pain medications, such as opioids, without the associated side effects and risk of addiction. Beyond its physical benefits, acupuncture can also address the emotional and psychological toll cancer can take on patients. The mind-body connection is a powerful force in health and healing, and nowhere is this more evident than in the realm of cancer care. Mind-body techniques such as meditation, yoga, and Tai Chi recognize the intricate interplay between our thoughts, emotions, and physical well-being. By cultivating a sense of inner peace, reducing stress, and promoting relaxation, these practices can empower cancer patients to actively participate in their healing process. Meditation, an ancient practice involving focused attention and deep breathing, has been shown to have numerous benefits for cancer patients. Yoga, an ancient Indian practice that combines physical postures, breathing exercises, and meditation, offers a holistic approach to cancer care. Tai Chi, often described as meditation in motion, is a gentle form of exercise that involves slow, flowing movements and deep breathing. Research suggests that Tai Chi can improve sleep quality, reduce fatigue, and enhance overall well-being in individuals with cancer. Integrative oncology represents a paradigm shift in cancer care, bridging the gap between conventional medicine and evidence-based complementary therapies. This patient-centered approach recognizes that cancer affects not only the physical body, but also the mind, emotions, and spirit. Integrative oncology seeks to address all aspects of a person's well-being, empowering patients to actively participate in their healing journey. Rather than viewing conventional and alternative therapies as mutually exclusive, integrative oncology aims to seamlessly weave together the best of both worlds. This may involve combining conventional treatments like chemotherapy and radiation with complementary therapies such as acupuncture, herbal medicine, and mind-body techniques. By taking a holistic approach, integrative oncology strives to enhance the effectiveness of conventional treatments while simultaneously mitigating their side effects and improving patients' overall quality of life. As more research emerges, we can expect to see a greater integration of these therapies into mainstream cancer care, offering patients a wider range of options to navigate their cancer journey with hope and resilience.